Hi, my name is Sydney Monk, and I will be discussing and presenting broken heart syndrome. You may be wondering what we'll be discussing in this presentation today. Here, the table of contents shows us what we will be reviewing. We'll be reviewing the definition of broken heart syndrome itself, looking at medical insights from doctors, taking a look internally through an x-ray, looking over some false accusations some people have about this syndrome. We'll also be looking at the statistical information backing up broken heart syndrome. And lastly, we'll be looking over the treatments and prognosis of this syndrome. A lot of people tend to question broken heart syndrome and if it is even a real thing. Yes, broken heart syndrome is a medical condition of the heart. This syndrome is always looked at as a conspiracy or metaphor, but this is real. Let's take a look at the definition for more insight. What is a broken heart? A broken heart is a condition that is characterized by sudden dysfunction of part of the left ventricle of the heart. It is accompanied by symptoms resembling those of a heart attack, but occurring in the absence of significant coronary artery diseases. This usually results from stressful and traumatic events. The most common traumatic event that causes this is a loss of a loved one or a bad life failure. Let's see what doctors have to say about broken heart syndrome. Doctors typically think patients are having onset signs of a heart attack because the symptoms are so similar. The heart muscles actually detach itself from each other from the upper portion of the heart, usually treated as a heart attack until further notices in an x-ray. This next definition you see on the screen is called toxotsubo. It's an octopus trap in which Japanese doctors use this name to describe the idea of the broken heart syndrome. Doctors use this name because the heart forms a round apex, which means the tip of the heart, and a narrow base, just like the octopus trap from the upper half of the heart, and begins deteriorating. It took doctors so long to figure out this because they were wrapped up in the fact that the heart can't actually break. Now on this next slide, we will see an x-ray image that will take us to an internal view of the broken heart syndrome. On the left side of the screen, you see an image pictured. This is the normal view of the heart. As you can see, the muscles are all compacted together as a normal view. On the right side, you see that the heart is more sagged and detached from each other. This is because of the broken heart syndrome. Maybe before seeing this PowerPoint, you might have had some false accusations of broken heart syndrome yourself, but you're not the only one. So let's take a look at some common false accusations some people have. Some common false accusations people have, they say it's just a theory. They also say that people commonly say they have a broken heart when they break up in a relationship. Also, some people think it's not medically proven. All these are accusations of the broken heart syndrome. Yes, it is something people say after a breakup occurs, but that does not prove it is just a theory. There are many cases statistically proven that it happens all over the world, many times a year. Doctors have officially proven in severe cases there is visually reliable sources showing that the muscles of the left ventricle detach from the rest of the heart, as seen in the previous slide on the x-ray. To counteract these false accusations, let's look at some statistics. These statistics are given by WebMD. It is 7.5 times more common in females rather than males. It is also 2.9 times more likely in females older than 55 years of age. Within 6,230 cases in a year, 89% were women. 1/3 of patients were between ages 50 and 65, while 58% of them were older than the age of 65 years old. After this past year, the common rate in females raised to 9.5%. 1/3 of all cases, a specific triggering event cannot be pinpointed in both men and women. In this situation, it becomes more difficult for the doctors to treat. And while talking about treatments, that takes me into my next slide. Treatments and prognosis. This is given by the Mayo Clinic. Typically, there are no standard treatments for broken heart syndrome, but doctors go about this treatment similar to the treatment of a heart attack. During the treatment, most patients will remain in the hospital until they recover. Many doctors will prescribe heart medications. These medications periods depend on the patient's severity. Heart medications such as ACE inhibitors, beta blockers, or diuretics. For exercise and all daily activities, doctors allow 4 to 6 months for the patient's heart to make an all-around recovery. This allows the heart to not undergo large amounts of stress during the patient's recovery period. Severe cases take extra attention, so doctors will go in and use treatments such as the balloon angioplasty, stent placements, or even surgery. These severe treatments cure blocked arteries and severely damaged heart muscles from the broken heart syndrome. Overall, the broken heart syndrome is a serious condition and needs medical attention immediately. And this will be the end to my presentation. Thank you so much for listening. Hi, my